Good morning. Want to call the Rules Committee to order and welcome to the Committee on Rules, Privileges, and Elections. Actually, we never had elections while I was doing this. My name is Karen Koslowitz, and I'm chair of this committee. We're joined here today by Councilmember Adrian Adams, Councilmember Margaret Chin, Councilmember Keith Powers, and Councilmember Paul Vallone. I just want to say, as we said before, this will be my last meeting of the Rules, Privileges, and Elections, and my last meeting of all committees, including the council meeting. I just want to thank everyone, the staff, my committee members, my counsel, Lance Polivi, did I say it right? Oh, finally. Finally. And all the sergeants of arms, to Chuck Davis and Carl, who keeps us in line. And I just want to say thank you for all that you have given me in being the chair. And of course, to our speaker, Corey Johnson, and Jason, who we call all the time and bother him. But thank you very much to everyone. Today, I would like we will consider the nomination of Gail Nayowith for the Board of Health. If appointed, Ms. Nayowith, a resident of Manhattan, will replace Susan Klitzman and serve the remainder of a 6-year term that expires on May 31st, 2026. The primary function of the Board of Health is to legislate and oversee the New York City Health Code, which encompasses the rules governing all matters and subjects within the jurisdiction of the New York City Department of Health and Mental Hygiene. The Department of Health's jurisdiction is among the most extensive and varied of all of the city agencies, from communicable diseases and mental health to food safety and veterinarian affairs. The fact that health code rules have the force and effect of law and cover such an extensive range of measures aimed at improving the physical and mental well-being of New Yorkers highlight the importance of the work of the Board of Health and consequently the vital need for crucial consideration of all potential appointees. The Board of Health's 11 members serve 6-year terms without pay and cannot be dismissed without cause. Welcome, Ms. Nayowith. Would you please raise your right hand to be sworn in?
Do you swear to tell the truth, the whole truth, and nothing but the truth?
I do.
Do you wish to make a statement?
Yes, please. Thank you so much, Chair. How's my tone? Is it too loud?
No, it's fine.
Good day to everybody, and thank you, Chair Koslowitz, Speaker Johnson, and members of the Rules Committee for considering my nomination to the Board of Health. I cannot imagine a greater privilege than the ability to invest in the health and mental health and well-being of New Yorkers by serving on the Board of Health at this critical time. Of course, my name is Gail Nayowith, and I'm principal of One Digit LLC, which is a project management and consulting practice that works with nonprofits, government, and philanthropy to meet community needs by increasing their ability to solve complex problems, build solutions that increase performance, impact, and reach. One Digit is a certified MWBE in the city and in the state. I came to New York in the 1970s and I fell in love with the city, and I have never left. I attended New York University, Columbia School of Social Work, and I majored in child and family policy, nonprofit administration, community engagement. I spent 40 years serving in various capacities, inside, outside, and alongside of government, working to make the city a better place for people to live, work, raise children, and age in place. I started to work in city government right out of grad school, and I spent my early career at what is now the New York City Department of Health and Mental Hygiene, HRA, and Health and Hospitals. I went on to lead Citizens Committee for Children of New York, and I continued there, focusing on child and adolescent mental health, maternal and child health, and what are now called the social determinants of health: homelessness, access to healthy food, income security, child care and early education, child welfare, juvenile justice, youth development, and community life. When I was at CCC, I created the city's first database on child well-being and community risk ranking, and we mapped, for the first time, disparities in health, education, community life, safety, and the like. I also drafted the city's first children's mental health plan, and I began the first campaign to get reinvestment funds from converting 25% of the savings from the closure of state psychiatric centers into community mental health services for children. CCC also secured the city's first investment in newborn home visiting and nurse-family partnership. And working with the council, we were able to initiate the city's earned income tax credit and the child care tax credit. I left CCC in 2007 to help open a new foundation, the Laurie M. Tisch Illumination Fund, and I served as the founding executive director, working with its philanthropist founder to create a portfolio that supported New York City organizations that focused on access and opportunity. We made place-based grants to increase the availability of healthy food in New York City food deserts, to make an investment in public art and civic service. We seed funded the New York City Green Carts. We worked to establish the Office of Food Policy, the NYC Civic Corps, and NYC Service, and those were among the early accomplishments of the foundation. We also developed an integrated hydroponic and aquaponics farming and culinary career development program at the Food and Finance High School. I had the opportunity to roll my sleeves up and lead a direct service organization, SCO Family of Services, in 2011. SCO is a regional network of 85 health and human service programs in 100 locations, serving 60,000 children, youth, and families in the city and Long Island. While at SCO, we redesigned the clinical and residential services and positioned the organization for Medicaid managed care. During my time at SCO, I also chaired the New York State Children's Medicaid redesign team, tasked with producing the state's mental health plan for children. I served as an officer and member of Cities of Service for 10 years before I stepped into the role of interim executive director in 2020 to plan and manage the merger with Johns Hopkins University Bloomberg Center for Public Innovation at Johns Hopkins University. I opened One Digit after that in 2015, before that in 2015. And One Digit helps leaders align their mission, their resources, and their operations through strategic and sustainability planning, organization design, and developing quality, performance, and risk management systems, also doing business and program development and public policy solutions. Some of my recent projects in my One Digit practice include leading the COVID-19 activation and engagement initiatives for nonprofits for the City of New York and working in the Vaccine Command Center. I've also there planned and implemented senior, youth, and homebound equity deployment vaccination campaigns, taking vaccine to people in locations that are close to where they live or at home. I designed, implemented, and built out with the teams Learning Bridges, which was the city's emergency child care system for 100,000 children, 3K to 8, when schools were closed. and just recently, this past summer, built the new hybrid academic and enrichment summer camp program for 200,000 kids K-8 called Summer Rising. We also redesigned the summer youth employment program to convert it to a digital and virtual career development and project-based learning program. And I also developed and implemented a court-mandated health and behavioral health plan and office for children in foster care for the state of South Carolina Department of Social Services, and a criminal justice diversion and substance abuse treatment initiative for the Staten Island District Attorney's Office, among many other projects. I've served on the board of the Kenworthy Swift Foundation. It's a small foundation that provides funding to New York City organizations that work to improve children's mental health and well-being. I've served on that board since the early 2000s, and I served on the New York City Board of Health and chaired the Community Services Board until last year, when I stepped down to work with the Vaccine Command Center on the city's COVID response. I publish occasionally, and in 2017 I co-authored a book. I write and speak publicly on matters of child well-being, family policy, the business of nonprofit organizations, health and human service policy, civic service, and so forth. I want to just thank you so much for the opportunity to be here today. I'm grateful to you all for considering me for an appointment to the Board of Health. Thank you, Chair Koslowitz.
Thank you. I have a few questions. COVID-19 has highlighted longstanding health inequities within our city. How would you like to see the city better address the health needs of the most marginalized New Yorkers?
Thank you. COVID has had a devastating impact on communities of color and on the essential workforce. What I would like to see is the ability to continue to provide access to vaccine, to provide guidance around masking and other precautions, to encourage people to get vaccination through rapid engagement and outreach that's targeted to their special concerns and considerations. I'm sorry, my glasses are fogging up. And I also would like to see a particular focus on older New Yorkers who have among the lowest vaccination rates in the city. To that end, I think what I would say, just in a nutshell, is continue to do the multifaceted work that's being done now, and to focus it more specifically as time goes on populations that are at extreme risk.
Can you please confirm that you will terminate any contract with Mox if you were appointed prior to the termination of your current consulting contract for your firm, One Digital LLC, in order to avoid a potential conflict of interest?
Yes, when I'm appointed to the Board of Health, if I'm given that opportunity, I will end my contract with Mox immediately.
Okay, and can you please confirm that you will seek COIB guidance for any potential conflicts of interest concerning your firm, One Digit LLC, upon your appointment to the Board of Health?
Yes, upon appointment to the Board of Health, I will write to the COIB asking for guidance. I have written to the COIB in the past, and what they advised was to inform them if my situation changed. So that would be consistent with the guidance that you're suggesting now, and I would do that absolutely and immediately.
Okay. Do any of my colleagues have any questions that they would like to ask? Councilmember Chin?
Thank you, Chair. Thank you, Ms. Nairwood. I mean, you have such a wealth of experience in this field of public health, and especially with mental health for our children. And I wanted to ask is that, how do you see, in terms of your role going forward, to make sure that mental health wellness opportunities are available and accessible to immigrant community, and to make sure that they know these resources are available for children, and also, as you talk about, for our aging population, to really bring more awareness and for people to know that these resources are available and how they can access, and also to overcome the taboo of mental health as something that community, and especially a lot of immigrant community, don't want to talk about, but do need this service.
The conversation around mental health has really changed in the last year since COVID. It's more in the popular press now. People are talking about it, and there is more comfort discussing depression, isolation, and anxiety, particularly because it stems from COVID. So it makes it more acceptable because so many more people in the community are having the same feelings. I think it's critically important to reach deeply into the immigrant community and to find ways to engage older New Yorkers in seeking help if they need it. The systems historically have not been good at doing that, and what needs to happen is to create more aggressive engagement and outreach, and to have targeted information that can be delivered by trusted messengers in ways that people can understand, language appropriate, culturally appropriate. The system itself is very hard to navigate, so everybody needs help finding a bridge to seeking the mental health services that they need.
Thank you. Thank you, Chair.
Thank you. Thank you, Chair, and welcome, Ms. Nailwith. As my colleague mentioned, you do have an extensive background, and I just want to thank you. I've been reading your work, and thank you for your work during this pandemic. It's been very, very substantial. One of the questions that you were asked in your pre-questioning was, what is your approach toward vaccine hesitancy? My community is Southeast Queens, and we have had vaccine hesitancy, and I'd be interested to know or hear you expound on your thoughts about that.
Thank you, Council Member. Everybody comes to their health care with a particular set of beliefs and experiences. And for people who have not had a good experience in the healthcare system, I don't know, I'm going to have to take these glasses off or something. I apologize, but I'm trying very hard to figure out how to see you and manage the fog.
I understand.
People come to their health-seeking behavior with a whole set of experiences, and it's very hard for people just to accept the fact that the vaccine works. So there are a number of things that are in place and have to continue to be in place for the long haul to help people make informed decisions, individual by individual by individual. Some of that requires explanations, again, by trusted messengers in the right places, whether it's a house of worship, there's a barbershop and beauty salon, nail salon initiative. There are ways to reach the community in places where they are comfortable, to have really meaningful, deep conversations so that people can get the information, think about it, and have an opportunity to go and seek vaccinations. The other thing is that the vaccination is accompanied by, always should be, by education around masking, hand washing or hand sanitizing, and precautions and safety measures that people can take. Essential workers have had to get vaccinated, so that's been a way to help people see that their neighbors are getting vaccinated and that they're safe. Kids are now eligible for vaccine. That's another consideration for families, and they can see other people's children who are being vaccinated. And it's going to come from an approach that reaches deeply into an interpersonal contact, and to make sure that people understand that they have choices and they can make good choices, and that vaccination will keep them and their families and their neighbors safe and protected from disease.
Yeah, thank you for that. I notice in particular, senior population in different places in the city seem to be more hesitant than others, and I was curious to hear your take on that, but thank you very much.
Hi there. Good morning. Craig, congratulations on your nomination. Just wanted to go through one of the issues that we have, as we're looking through the book, is just sort of your transition from private sector to public sector. And I know that your, I think, confirmation would take place after you discharge with your contract. But can you just give us a sense of what your contract right now with Mox and how you plan to recuse yourself or handle any matters? You're obviously in the space that you're working in right now, and just how you might handle to put in safeguards with regard to your work now as you transition over to the Board of Health.
Before I took on that responsibility, I wrote to the COIB about appearing before the Board of Health because I was a former board member and chaired the Community Services Board. And we basically concluded that I would not appear before the Board of Health or the Health Department, and that I would have other vaccine-related projects to work on. And so that's what I did. I created a firewall and did not have those engagements. Now, in the case, with vaccine, it's complicated because the guidance comes out and you want to make sure you understand it before you translate it to the nonprofit sector, or what, in that case, what I was doing. And, but it was, my contact was very minimal. I had no business before the Health Department or the Board of Health. And I continued to work on other projects. So, for example, I described Summer Rising, Learning Bridges. I have been working on the transition from the Sanitation Department's emergency food to the Department for the Aging's Recovery Food Program. So there are all kinds of things that happen that are COVID-related that I have been able to work on without having to appear before the Department of Health or the Board of Health.
But we're not, no, we're talking about the flipping. So how, when you,
So I will end my contract upon appointment. I mean, that's my commitment.
and if there's an issue that, will you have clients after you become a member of the Board of Health?
I can't hear you, I'm
I
sorry.
said, will you have any further clients after you leave the Board of Health?
Not with the City of New York.
Now this is New York. Can you clarify that? Sorry, what do you mean not with the City of New York? I mean, you will have clients, but they won't do business.
I have, One Digit is a consulting practice. I am a little long in the tooth, and I've had a long career, so I was hoping to cut back. But I will probably do 2 small projects. They will not really be, they're not government related, they're nonprofit related. So I won't really be in a conflict situation.
And if they were come before the board, I presume you would have to recuse yourself or figure out some way to.
Of course.
Got it. Okay.
But the 2 that I'm thinking of don't have, there's just not,
You don't see a conflict?
no,
in it.
I
All
don't.
right. All right, thank you.
Thank you.
Now open it to the public. Anybody? Seeing nobody? We're ready for the vote.
Matthew DiStefano, Committee Clerk, Committee on Rules, Privileges, and Elections. Roll call vote on the preconsidered M, submitting the name of Ms. Gail Naomith for appointment to the Board of Health. Chair Kozlowitz.
I vote aye.
Chin.
I vote aye.
Balone.
Madam Chair, just a moment to explain my vote. Karen, just a moment to explain my vote. Just a moment to explain. Thank you. I will not be able to be later at the stated. I will be remote, and I wanted to thank serving with you as chair and as Glean's delegation leader and as a friend to the entire family here and in my family. It has truly been an honor. And I wouldn't get the chance to say that later. And to my fellow council members who are here, and Margaret, you were my first chair. We were always the right and left hand of seniors. Adrian, so many brighter things are coming your way soon, and you're so proud of you. And Keith, we go back enough, and it's been an honor. And sorry you got that in the middle of you're going to have my yes vote, and I thank you for what you bring to this position, and I'm sure you'll work out how that transition is going to happen. But this will be the last until hopefully my kids. Since 1974, there's been a Vallone in the city council, and as of December 31st, that 48-year streak will end, and it has been truly an honor. So my kids are quick to take that mantle and get back at some point, but finish school first, I told them, finish school. So Karen, with that, God bless you. Thank you for everything you've done, and I vote aye with an open heart. Thank you very much.
Adams. Powers.
Permission to explain my vote? Thank you. First of all, I want to thank Chair Kozlowitz for running this committee so well and for the work you've done here in the council. And I found a number of occasions we've encountered pieces of legislation or issues that we're working on here that were things that Councilmember Kozlowitz worked in her prior term here, especially when she was the chair of the Consumer Affairs Committee. So her legacy is undoubted here in the council, and the way she has conducted herself, I think, is a model for all of us in terms of being strong, being a great legislator, and being a great colleague. So I want to say a very big thank you for that, and you will be missed in a very sincere way. I am voting aye on the appointment. I appreciate you taking the time to answer the questions as well. You're not my constituent, but I think you're across the street from me, so you're in good hands too. But anyway, thank you for your service, and we're looking forward to working at a very important time, and I'll be voting aye. Thanks.
By a vote of 5 in the affirmative, 0 negative, and no abstentions, the appointment has been adopted.
Thank you so kindly.
This meeting is adjourned.